So a few things that I get asked frequently that people are most self-conscious about. Number one is how to wear the robe, where do I change, those kind of things. So in our clinic room, we first of all have a changing station behind this curtain there, so give you some privacy, and there's a mirror back there so you can also get put back together afterwards. The robe seems to create some confusion and nervousness there. So typically our robes are going to look like this. There is oftentimes a tie in here. We usually will have you put it on so that it opens in the front, just like you're wearing a house robe. You'll put that on, place that on. You can tie this around your waist to hold it in place better if you're more comfortable with that, but it is not necessary. The sheet that you will open up to your level of comfort, and it just lays across your lap as you sit on the bed here. And this is just for your modesty there. There's no need to wrap it around you. In fact, we recommend not wrapping it around you because it makes things more difficult. When it comes time to the exam, we may have you on the bed, lay out here. We may pull out this table part of that. It'll come all the way out. And then if we're doing the pelvic exam, we'll probably use the stirrups, which will open up like this. Your feet will be placed in here. Now, a couple things I always tell my patients that are really important with speculum exams to decrease the discomfort, which is what most people are very concerned with, is number one, excellent positioning, being far down the bed. So this is where you see all the memes and the jokes of the gynecologist telling you to scoot down further. The purpose for this is when you're down the bed and you're actually hanging off, your bottom's hanging off just a little bit, it actually rotates your pelvis in a way that it makes your cervix and the pelvic structures more accessible. The other thing, which is probably the most important part, yet the most difficult, is to relax that pelvic floor. I tell people the easiest way to do that is if you think about letting your knees fall and relax out to the side. It's really self-conscious, and I understand it's probably one of the more difficult things to do, but the more you can focus in on that and let that relax, the less your pelvic floor is fighting us and the less discomfort we'll experience. But we will all take our time, go easy, talk you through what we need to do so that we can make this as less of a uncomfortable and self-conscious process than it has to be.